최근 세계를 휩쓸고 있는 코로나의 새로운 진원지로 브라질이 떠올랐습니다. 브라질의 급격한 감염자 및 사망자 증가로 인해 세계가 P1 변종을 주목하고 있는 상황에서 우리도 이것을 제대로 알고 대비해야 하겠습니다.
잘 알다시피 축구의 시작은 영국이지만 새로운 개념의 기술 축구를 꽃피운 건 삼바의 나라 브라질입니다. 마찬가지로 코로나의 시작은 중국이었지만 강력한 브라질 P1 변종의 출현으로 이제 또 다른 세계적 유행이 올까봐 많은 전문가들이 걱정하고 있습니다. 이미 미국 국토의 절반 이상에서 P1 변종이 발견되었고 한국에서도 상당수의 변종 감염자가 확인되고 있는 가운데 지금 브라질에 인접한 남미 대다수의 나라에서는 새로운 유행으로 코로나 감염자가 폭증하고 있습니다.
현재 브라질 상황을 간단히 정리해보면 2020년 11월 아마존 마나우스 지역에서 P1 변종이 최초로 발견되었고 최근 4월 7일에는 하루 4,195명 사망이라는 기록을 세웠으며 현재 누적 37만 5천여 명의 사망자가 발생했습니다.
현지에서는 폭증하는 시신을 처리하기 위해 공동묘지 야간 작업은 물론 기존의 매장 지역을 파헤쳐 복층식 재개발 방식으로 매장 공간의 추가 확보를 꾀하고 있는 처참한 실정입니다. 또한 집중치료실과 의료 인력 부족 등 완벽한 통제 불능 상태에 돌입하기 직전이며 장기간 지속되는 경제 침체에 서민들의 무료급식소 줄서기 행렬이 계속되고 있습니다.
브라질 P1 변종의 대략적 특성은 2배 이상 강해진 전파력에 증상의 진행이 더욱 빨라졌고 호흡기관에 더욱 치명적인 것으로 보여지며 젊은 층 환자들 또한 급증하고 있습니다. 아울러 또 다른 변종의 출현 가능성도 있다고 말합니다.
그렇다면 사망자 급증, 의료 시스템 붕괴의 원인은 어디에 있을까요? 대다수의 브라질 국민은 물론 많은 전문가들이 대통령 보소나로를 거론하고 있습니다. 그는 마스크 미착용을 부추기는 모습을 자주 보였고 코로나 전파 억제에 필수적인 록다운 조치 시행을 거부했으며 방역의 관리 주체인 보건부 장관을 4번이나 경질하며 각종 방역 노력을 지속적으로 방해 폄하하고 국민 갈등을 유발하기까지 했습니다. 그 결과는 대량 학살과 다름없는 최악의 상태로 브라질을 몰아갔습니다.
보소나로는 왜 그랬을까? BBC에서는 그가 트럼프식 인기몰이를 흉내내고 있다고 보고 있습니다. 일부 부유층과 핵심 보수층의 지지를 끌어내고 그들만의 이익을 대변하는 분열의 정치를 신경생물학의 세계적 권위자이며 브라질의 의사인 미구엘 니콜렐리스는 그를 브라질 국민의 제1호 적, 나아가서는 세계의 적이라고 표현하고 있습니다. 브라질 상원에서는 4월 13일 그의 전염병 대응 과실에 대한 공식적인 조사를 시작했습니다. 브라질이 마주한 현실을 알 수 있는 세계 각국의 주요 뉴스 몇 개를 함께 보겠습니다.
Ambulances race across cities in Brazil, desperate to slow the death count from COVID-19. But it's a losing battle, with record figures, 4,195 deaths in just one day. Brazil is now considered the global epicenter of the pandemic. Contagious new variants have overwhelmed hospitals, with hundreds dying as they wait for treatment.
The infections have reached a plateau, it seems, but the deaths haven't started declining. So it seems like we are still in for about 2 more weeks of increasing deaths.
Some cemeteries have been holding nighttime burials to deal with the growing numbers. Brazil's death toll of 337,000 is second only to the United States.
We should have had stricter laws like in some other countries. It would have been hard for people at that time, but we would have had a much lower number of deaths, I think.
President Jair Bolsonaro has pushed back against mask wearing and lockdowns. Last week, he swore in a new health minister, his 4th since the pandemic began. Brazil was also slow to secure vaccines. So far, less than 10% of Brazilians have received their first dose.
There are still a lot of people to be vaccinated, so we have to go faster, act faster. If they had acted faster at the first stage of the pandemic, there wouldn't be this death rate.
Argentina also marked a record, more than 20,000 new COVID-19 cases in 24 hours, its highest daily count. The government responded with tougher restrictions. Argentina's President Alberto Fernandez is isolating after testing positive, but in Buenos Aires, residents say life must go on.
We have to go to work. There is no other choice. We have to go out. And well, we're going through a spike. Many cases, many cases.
Chile is also seeing a surge in cases. The government reacted by postponing elections originally scheduled for this weekend.
We are confident and will work with no rest so that on the 15th and 16th of May, sanitation conditions will be more favourable for elections, so that the people's health is not at risk and we have a high level of participation.
A morbid picture across much of Latin America, but in Colombia, a story of survival. 104-year-old Carmen Hernandez was discharged from hospital after 3 weeks. It is the second time she has beaten the virus. Charlotte Bellis, Al Jazeera.
Every bed contains a patient struggling with COVID-19, and almost every ICU in Brazil is full to capacity or over. Individual struggles adding up to a nationwide catastrophe that potentially threatens the world. Here in Brazil, the coronavirus hasn't yet reached its peak. I visited the San Andres Field Hospital in Sao Paulo during Brazil's first wave last year. It's in a volleyball stadium, and they said it was temporary. But to the despair of Dr. José Roberto Marsondente, it's proved anything but.
Em relação ao ano passado, a gente nota que os pacientes eles estão evoluindo de uma forma mais rápida. A idade média de internação abaixou de 10 a 20 anos. Antes a nossa idade média era alguma coisa entre 60 a 70 anos, né? E hoje em dia isso abaixou para 45, 40 anos, 55 anos.
The P1 variant, first identified in the Amazon city of Manaus, is now the dominant strain across Brazil.
Com certeza houve uma mudança na agressividade do vírus e também na prevalência da doença. Ela está transmitindo mais, está acometendo pacientes mais jovens, está causando mais óbitos, está causando mais quadros de insuficiência respiratória com necessidade de intubação.
Tudo bem, mãe? Tudo bem, pai?
38-year-old Wesley da Silva Marcelino is recovering and able to speak to his family.
Falta pouco, graças a Deus. A gente venceu essa guerra aí.
He's shedding tears of joy and relief. He can't wait to hug his children.
Saudade. Duro. Você pode ter a chance de nunca mais ver eles. Você tem a chance de você nunca mais ver. Muito triste. E o pessoal não acredita, né? Só quem passa aqui realmente, mesmo que vê que é grave.
Abriu o olho dela.
But tears of grief are increasingly common.
Era meu filho. E eles não sabem quanto meu filho era tudo para mim. E por isso eu me revolto com isso. É muito descausa aqui nesse Brasil. Sabe quando é que eles enxergam a gente simples, humilde? É na hora que precisa de um voto.
Brunan Cardoso was only 22. Here he is, inviting friends and family to a barbecue. He holds the unbearable distinction of being the first person in Sao Paulo to die because he couldn't get a bed in ICU. He was allocated one 19 minutes after he died.
Da formatura dele de escola. Essa é a nossa vida. Essa é a nossa razão de viver. Levantar dia após dia.
Queuing up for vaccination, but only 8% of Brazilians have had the jab because the government failed to procure enough. Epidemiologists say that widespread vaccination is the only way to get ahead of new variants. But hesitancy is rife, in part because President Bolsonaro joked that those who'd been vaccinated might turn into crocodiles. The queues for the soup kitchen are even longer. Bolsonaro refused to order a nationwide lockdown because he said he wanted to protect the economy. But his policies have protected Brazilians from neither poverty nor the virus.
Aqui em casa está todo mundo desempregado, é a minha sogra que me ajuda e ela também trabalha de faxineira. E esses dias está fraco as faxineiras por causa da pandemia, não é, todo mundo está chamando ela todos os dias. E eu vim para cá para pegar comida todo dia.
In the city's main cemetery, they're exhuming the dead to make way for more. The P1 variant of COVID-19 is ravaging Brazil. It's already spread beyond the borders. And if the Brazilian government doesn't act now, more variants could yet emerge.
Lindsay Hilson there with that report. And I'm joined now from Sao Paulo by a professor of neurobiology, Dr. Miguel Nicoleles. Dr. Nicoleles, you're looking at the graph of this disease. It's terrifying. It shoots right up against everything that's gone before. How serious is this for Brazil?
Well, this is the largest humanitarian tragedy in Brazilian history. We have never seen anything quite like that. As you said, in the second wave, we have a nationwide hospital collapse. We have a pandemic that is completely out of control. We have new variants showing up in different parts of the country. And just today, the state of São Paulo has released, again, a new record of 1,389 deaths in the state, which is, something nobody ever thought could be reached. Just to give an idea, 3 weeks ago, we had half of this number of deaths in the state of São Paulo. So it's a cataclysmic event in Brazilian history.
This is a new variant, and you mentioned other new variants in Brazil. How much of a threat to Latin America is it? How much of a threat to the rest of the world?
Oh, I think this is a gigantic threat to South American, Latin American, and the world as a whole, because the variants have spread very widely throughout Brazil, and we share borders with 8 countries in South America, and these borders are very porous. So I have no doubt that the variant is spreading, as it has already been detected in Uruguay, in Bolivia, in Paraguay. So we heard about outbreaks in Canada, in Japan, in Australia. So there are 36 countries that have confirmed the P1 variant already. So any variant that shows up in Brazil is likely to spread through the continent in a few days, and in a few weeks could spread to the whole world.
I worry about asking you this as you're sitting in Sao Paulo, but how far is President Bolsonaro responsible for the way in which this whole business has been tackled?
Well, certainly he's the most responsible person for the cataclysmic event that we are living through. He denied the relevance of the crisis. He didn't take the right measures from the beginning. He mocked the efforts to get vaccination going on across the nation. He didn't allow his ministers of health, and he has gone too far by now, to do what had to be done. So in simple terms, he is the public enemy number one of the coronavirus fight in Brazil, and I dare say he's public enemy number one in the entire world, because no other government, no other president has done so much to undermine the efforts of the scientific and medical community to tackle this tragedy here in Brazil and around the world.
And can I ask a very brief question? Should the World Health Organization intervene now?
Oh, I think so. I think the World Health Organization should help Brazil procure enough vaccines. Brazil can purchase these vaccines, can purchase millions of doses right now. So I think this is a global threat. This is a global problem. And the international community should help Brazil to get out of this, because until the pandemic is controlled down here, it is not going to be controlled around the world.
In Sao Paulo, Cemeteries forced to conduct nighttime burials to keep up with the flood of coffins, as Brazil passes the grim milestone of more than 4,000 COVID-19 deaths in under 24 hours, nearly 4,200 on Tuesday.
O Brasil é o epicentro da pandemia Covid-19 no mundo. Dia 1º de julho, o Brasil vai superar a marca de 500 mil de óbitos por Covid-19.
Almost 340,000 Brazilians have now died of the virus, a death toll surpassed only by the United States, which has roughly 1.5 times Brazil's population. Hospitals are overwhelmed. COVID patients now occupy more than 90% of intensive care beds in most Brazilian states. Critical treatments, including oxygen, are often in short supply, with patients in some cities dying as they wait for care. The situation has been aggravated by the emergence in Brazil of new, more contagious strains, such as the P1 variant that emerged in the Amazonas state last fall. A political tug-of-war over lockdowns hasn't helped. Far-right President Jair Bolsonaro has continuously opposed them, resulting in a patchwork of economic and social restrictions at the city and state level.
Se fosse uma lei pouco mais rígida que nem em alguns países, mais rígida, né? Mesmo que as pessoas sentissem abaladas no momento, mas a gente teria número de pessoas óbitos bem menor.
Bolsonaro is now on his 4th health minister since the pandemic began. After initially casting doubt on vaccines, he's now promised to make 2021 the year of vaccinations. So far, though, less than 3% of Brazil's 210 million inhabitants have been fully vaccinated.
Now, Brazil has recorded over 4,000 COVID-19 deaths in 24 hours. That's its worst day since the start of the pandemic. Its death toll overall is now past 330,000. And the situation is pressing, with thousands of patients struggling to access healthcare. Have a listen to this ICU doctor in the town of Porto Alegre in the south of Brazil.
We have been working at full capacity for quite some time right now. What we are seeing is that it has been a long time since we have attended patients with anything other than COVID in intensive care units. And everyone is exhausted right now. We are exhausted because we haven't seen our families for such a long time. For instance, I haven't seen my relatives for the past 15 months. Also, we are not hopeful that anything can change in the following weeks. We are vaccinating at a very slow pace right now.
Next, I want to show you this graph, which shows the death toll. In March alone, over 66,000 people died. That was double the previous monthly record. And that has put pressure on not just the healthcare system, but on cemeteries too. This one in Sao Paulo is continuing burials through the night. Also in Sao Paulo is this doctor.
We are having difficulties in getting people trained enough to manage critically ill patients. Exactly 1 year that I made the first autopsy of COVID-19 in our hospital and identifying the nature of the disease. And I was, at that time, I didn't imagine the impact and the extent that the disease will reach in Brazil. And because of this rare and bizarre combination of bad policies, also the social vulnerability of the population, because some levels of population cannot afford to do social isolation, and also by the emergence of new variants.
Well, the variant he's talking about is called P1. It's more commonly known as the Brazilian variant, and it's thought to be twice as transmissible as the original strain of COVID-19. It was first detected in Manaus, in the Amazon, in November, and within 2 months it was accounting for 73% of cases in the city. Now, though, it's spread far beyond the Amazon. It's driving a surge in infections across South America, in Peru, Uruguay, Paraguay, Bolivia, Venezuela, and in Argentina. Here's Dr. Paulo Salvida again on why this strain is different.
This new variant, we have cases at a younger age. So now people under 14 are in parallel, in the same extent affected as compared with older people. So we are having more young people suffering and even children dying because of a lack of assistance. The system is in the edge of a collapse.
So there are pressing concerns now, but there are also concerns this variant could have impacts for months. One doctor who coordinated the pandemic response in the northeast of Brazil is warning we may get to 500,000 deaths by the 1st of July. That's the latest estimate. So that would mean an additional 170,000 deaths in the next 3 months. 170,000. And bear in mind that while some countries like France have brought in lockdowns to deal with new variants, Brazil is currently easing restrictions. Here's just one example. This picture is from Sao Paulo on Tuesday. As you can see, this train station is packed. And here's one epidemiologist on why Brazil's approach is causing problems.
The difference between the P1 variant here and the others is that the P1 variant is circulating pretty much freely here in Brazil, so we are not adopting the lockdown measures needed. Many people are not using masks, so the variant is facing a very friendly field to go disseminate and infect people. This is what concerns me the most.
And if that's the variant, another factor is Brazil's vaccine rollout. It started in January. Currently around 8% of the population has received at least one dose. This man is responsible for the rollout, Marcelo Queiroga. He's Brazil's health minister. He's the fourth person to do that job since the pandemic began. He's also a doctor, which some people are finding reassuring. Here's Dr. Pedro Halal again.
The new minister, he's trying to do things based on science. His main enemy is the president himself. So realistically, the new minister is trying to do the things right. We have accelerated the vaccination, so our goal needs to be 1.5 million doses per day, and we are actually getting to 1 million per day, which is actually good because our previous average was around 300,000 per day. And this minister admits the possibility of doing lockdowns, which is something that the president doesn't admit.
Now, we have heard from a lot of people already, but we need to talk about the man in the middle of the story, the man who's just been referred to. Brazil's President Jair Bolsonaro, he's played down the severity of the virus, he's defended unproven drugs as treatment, he's raised doubts about vaccines and has resisted national lockdowns. And as you've heard, he has many critics. One of them is the governor of Rio Grande.
What we are facing here in Brazil, what we have here, it is a sad situation that is the consequence of the lack of coordination in the federal level by the national government that we have here. It is President Bolsonaro confronting governors and mayors in the main tool that we have, the main weapon that we have to not allow the coronavirus to spread in an easy way, and the weapon is the social distancing. His behavior is unfortunately killing Brazilians, and it is hurting our economy.
So we've talked about the variant and the vaccine rollout and the president. We should also say there's a tension between messages coming from the president and his government and messages coming from state-level governments. Have a listen to a cardiologist in Sao Paulo on this.
The problem is that every day we watch someone of the president team and your sons giving contradictory information to the population. This is a political scenario of polarization, keeps people away from the reality. It's common to see people think that the number of deaths is not so high or seeking ineffective treatment supported by these statements. We hope that the new minister can change it.
It's also worth noting Brazil's president has shifted his tone on immunisations recently, pledging to make 2021 the year of vaccinations. However, his position on a national lockdown remains the same. Last week he said, "We're not going to fix this problem by staying at home. No nation can sustain itself for long with that kind of policy." Well, for further analysis on the point Brazil's reached, here's the BBC South America reporter Daniel Gallis.
specialists in Brazil, health experts, don't really know whether, the absence of lockdown may have contributed to this worsening of the crisis. Could it also have been that Brazilians are more relaxed throughout the summer? They're not adopting social distancing practices. All of that we have seen, but of course the Manaus variant is more deadly. It's spreading more easily, and it also may not be as resistant to the vaccine, although vaccines are proven to tackle the Manaus variant. And of course, this is a threat to the world as well, because as we've seen these variants, it's almost impossible to contain them in one country, and they can spread across borders even if travel is banned from countries.
Brazil's battle against a dangerous coronavirus variant could be a warning for the United States. Brazil's hospitals are at the breaking point under a skyrocketing number of new cases. The surge is being driven by a more infectious strain known as P1. It originated in Brazil and already has been found in more than half of these United States. Manuel Bojorquez is in Brazil's hard-hit Sao Paulo. Manny, good morning to you.
Good morning, Tony. The situation here really is dire. When the P1 variant started to take a hold last month, more than half of the states here in Brazil were already reporting ICU capacity at 90% or higher. We got an inside look at how the situation is pushing the health system to the brink.
Every single patient at Sao Paulo's Vila Penteado Hospital suffers from COVID-19. There's no room for any others.
In your experience, how many of these 9 people in this one room will recover or not?
Menos da metade.
Less than half will recover.
Surprisingly, Dr. Daniela de Jesus says more and more of these patients are in their 20s, 30s, and 40s. Unlike ICUs in the U.S., these wards are open, no barriers between patients.
You really get the sense of worst case scenario being in this hospital. In this room, people are being intubated. In the other room, we saw someone getting chest compressions.
It's a daily struggle that haunts those working here.
Na maioria dos casos, esses pacientes, a última...
You're the last person they see before they die.
Scientists believe a variant that originated in Brazil known as P1 is helping to fuel the surge here. Dr. Miguel Nicoleles is a professor of neuroscience at Duke University.
For sure, P1 is 2.5 times more transmissible and more infectious.
Why should people in the United States care about what's happening here?
Well, if I were talking to someone in Oklahoma, I would tell him or her, be very worried about it. Because if Brazil is out of control, the world will be out of control in a few weeks. Because variants that are brewing here every day, every week, they will escape.
He says he spoke out about the worsening threat months ago, but few listened. Most notably, President Jair Bolsonaro, who has been criticized for downplaying the pandemic and fighting restrictions put in place by some governors, like Sao Paulo's João Doria.
We are fighting against 2 viruses at this moment, the coronavirus and Bolsonaro virus.
Doria has drawn the ire of Bolsonaro's supporters, but believes the limited restrictions he's been able to enforce, like closing shopping malls, have started to show results.
We need at this moment to be united against the virus, not divided.
Are you still advocating for a lockdown right now?
We are advocating lockdown right now. We're having the red phase at this moment. It's a lockdown, a local lockdown to preserve lives and to oriented people to stay home. At this time, please stay home.
Just yesterday, Brazil's Senate launched an official investigation into Bolsonaro's handling of the pandemic, which could lead to a referral of possible wrongdoing to law enforcement. The health ministry here says so far just roughly 3% of the population has been fully vaccinated. Gail?
Really good point you made there, Manny, that just because it's in Brazil doesn't mean we shouldn't worry about it here. We are definitely paying attention.
The estimated number of people around the world who've died due to coronavirus has now topped 3 million, with the highest number in America, followed by Brazil, Mexico and India. In Brazil, so far, more than 370,000 people have died, but President Bolsonaro refuses to order a lockdown despite continuing infections. Our correspondent Mark Lowen has sent us this report from Sao Paulo.
Every day, the faces of despair multiply. The food lines in Sao Paulo's largest favela go on and on. With most here working in the grey economy, queues have more than tripled as COVID takes lives and livelihoods of Brazil's poorest. For Luciana Firmino and her family, this is their only meal of the day. She lost her job in a manicure studio with the pandemic, and they're unable to pay the rent.
I've lost hope. We will have to live on the street or under a bridge soon. Sometimes I think I should give my children away to social services.
It feels like a different country among the rich farmers and backers of the president. Harvesting the corn, Frederico Davila says Bolsonaro is cutting through a corrupt establishment. But with his hostility to lockdowns, slow vaccine purchase, and Brazil shrouded by over 365,000 deaths, the president's critics call his handling genocidal.
President Bolsonaro is not focused in killing anyone. He wants to preserve the liberties of the people. He wants people to get out, to get work.
The cost of that is the second worst death toll in the world and a hospital collapse.
No, it's not true, because these 365,000, we don't know if they are died by corona.
To understand President Bolsonaro's support, even after the awful toll of the pandemic here, just look at his inspiration, Donald Trump. Both paint themselves as anti-establishment, both captured the populist mood, and both, despite mismanaging the pandemic, have kept their devoted following, from the wealthy farmers to the conservative base.
Blasting out his message are the evangelicals, streaming part samba, part sermon. Online is key to rallying the Bolsonaro faithful. They back the president's push to reopen churches.
The church votes in favor of Bolsonaro because he defends the family, he's against abortion and school books promoting LGBT groups. He fights for Brazil with Christian values. And if he doesn't want to wear a mask, that's his right to choose.
With a divisive president and a virus and poverty exploding, Brazil faces a perfect storm. They're preaching to the converted here, but increasingly for this devastated country, they're empty words. Mark Lowen, BBC News, Sao Paulo.
최근 인도에서 발견된 변종 등 새로운 변종에 대한 백신의 효과가 불분명한 상황에서 코로나 바이러스를 한 나라에 가둬두는 건 불가능합니다. 우리도 강 건너 불구경할 때는 아닌 듯합니다. 지난 1년 이상 우리 모두 애썼습니다. 조금 더 참고 노력합시다. 우리는 이겨낼 수 있습니다.